Dr. Marianne Brandon. How good to see you.
Oh, it's so good to see you too, Dr. Abe Morgentaler.
So here we are, another episode of The Sex Doctors. And today we're going to talk about something a little wow.
Well, you've had this conversation with other people. Like, we have friends over. You've brought this up. It's in your book. So,
Yeah.
this is a conversation that we've participated in. And people are always like, what? Guys do this?
Right.
And I'm like, of course guys do this. Like, what's the big confusion? But apparently a lot of people just assume
Right.
that it can't happen for a guy.
I know. Do you know what we're talking about?
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
We're talking about men faking orgasms. Yes, you heard it here. So what Marianne was kindly referring to was that my last book was titled Why Men Fake It. And a lot of it was based on stories of my patients. And there was this young man in his 20s who came to see me. And he had trouble having an orgasm with intercourse. So he could masturbate and get himself to climax, but it didn't happen to him during sex with women. And so while he was dating and in college, he thought he was like Superman because he could just keep going like the ever ready bunny, right? And so everybody had like this long experience, and when he was done, he could just disengage and he could finish himself off. Whether the women knew it or not, I don't remember exactly, but that's what he would do. He would take care of himself. And then one day, as it would happen, the problem arose, which was he fell in love.
Oh, I don't remember this part of the story.
And so he started having feelings for this woman, and she started feeling badly about herself that he couldn't have an orgasm with her.
So she knew that he wasn't.
So he wasn't climaxing.
Yeah.
No, he wasn't faking anything yet, but this is what led to his start of the faking.
Oh.
And so she started feeling like maybe she wasn't attractive enough. Mm-hmm. Maybe she wasn't sexually skilled enough.
Yeah.
Maybe she didn't excite him. And
which is what guys think when women fake, by the way, all these things that you're saying.
You think so? We need to come back to that.
Yeah.
We need to come back to that. And so in the end, and as he described it, like they had long periods of sex trying to make it so that he would finally come. Mm-hmm. And he was rubbed raw.
Oh, geez. Well, she probably was too, if he was.
It depends on what they were doing.
Okay, yeah. Yeah,
right? Because it wasn't all necessarily vaginal sex, right? So in the end, he faked it. He faked an orgasm. And
she was so happy that he finally came, and now he has a problem on his hands. Is that what happened?
So he started doing that routinely. Why did he come to see me? He came to see me because he really wanted to be able to have an orgasm with intercourse. Mm-hmm. And it was his fear and belief that if his now let's call her lover, in the true sense, I mean, he loved this woman, that if she found out, she would break up with him.
Aww.
Because she would feel like he's been dishonest with her.
Right.
That he'd been faking this thing.
Yeah,
right, because this is the most intimate way.
Moment.
Right.
Yeah.
You have these shared things. Yeah. Everybody's vulnerable.
He's got to be adding some drama to it, like to make it seem like an orgasm. He's got to add some theater to it.
Right.
So,
there's the performance. It's not real, right?
Right.
So, and when he first came to see me, now I've got some gray hairs on me here, but this was a long time ago, and I'd never heard of a man faking it. And it wasn't even clear to me why a man would. And so when we kicked off the beginning of this episode, we were saying most guys say like, what? Like they'd never heard of it. Why would a guy need it? Because part of the stereotype of men, if you will, is that men can, I mean, they often come too quickly, but of course a man is going to come during sex. And what's missing is this idea that for some men, it may not be that easy to come.
Right. And really, research shows that for most people can orgasm faster with masturbation. So
Sure.
that's just a little, well, see, you say sure, but many people don't realize that. So a lot of people feel guilty, like, how come I can come easier, by myself than with my partner? Well, that's kind of typical because people know how to touch themselves, right?
Exactly right. You're getting the biofeedback. You know exactly what's feeling right. Right. And you know whether to keep going, move, faster, slower, firmer, less firm, right?
Yeah.
Right. So somebody else's anatomical part doesn't exactly get that same feedback, right? Best you can do is moan or something, or say, keep going.
Well, I think when people are kind of amazed that guys can fake it, I think they're like, well, where's his cum? Like, where's the evidence?
So I got to tell you, so when this guy first tells me the story, that's what I'm thinking.
Yeah.
Because it was the first time at that moment with that patient,
Right.
that was the first time I'd ever heard it. I'd heard it since. And we're going to talk a little bit about what the research shows, but that was my thought.
Yeah.
How does she not know?
Right.
What's she going to do with the semen?
Right.
So I asked him.
Yeah.
I said, so what do you do with the semen? Like, how do you actually fake it? So I can get like the performance part, right? Like, right.
Yeah.
Well, we're not going to act it out here, right?
Yeah.
This is, I don't know if you got to be over 18 to watch this. I don't know if you have to be, but no. But we're not going to get too graphic.
Right.
So he said, well, listen, at the beginning, it wasn't a problem. I was wearing a condom. And I would just, after we were done, I would just run off to the bathroom and I'd get rid of it. And nobody knows whether there was anything inside or not. Later, as they became exclusive and were comfortable with each other, they stopped using condoms. And I said, well, what about now then? And he says, well, I don't know. It seems to me like there's a lot of fluid down there. And she probably doesn't know the difference.
Well, I do think that's a way that guys can get away with it, is if his partner is well lubricated, it may not be that evident.
Right. And of course, what's missing from the conversation and from our knowledge base here is whether or not she actually did know or suspect or not. We're just taking his word for it, right? Because I've told this story, and as people gotten back to me after I wrote about this in my book, I've had women say to me, oh, I would know.
Yeah.
I would know for sure,
Yeah.
Based on the amount of fluid or so.
Right.
But,
I don't think people are in that headspace.
Or sometimes the women say, I mean, I can feel it.
Well, that's true. But nonetheless, that doesn't mean that she's going to be thinking all the time like, was that a real orgasm? Like
Right.
She's going to fall asleep or whatever she does and not really think about it.
Right. Or hopefully her brain is otherwise engaged in actually the pleasure of it. Right. Yeah. So anyway, so that was his story. And anyway, so that's that. And the question is, like, how rare is this?
Yeah.
Well, before we get to how rare it is and what the studies show, what you must have some reactions to all of this.
Well, the concept of faking orgasm isn't a rare one in my therapy office, but it's always from the woman. The woman's always telling me she's been faking for a while. She doesn't know what to do about it.
And it's classic. And guys worry about it and they tease each other about it, right? Like sort of whether it's a friendly put down, if there's such a thing, or another one is like the comment, you can't make a woman come. They say, oh no, of course she comes every time. Yeah, she's faking it, buddy, right?
Yeah. And so women will get into that tricky position of faking so much that now what does she do?
Yeah.
But I've never had a guy say that. I've never actually had a guy in my office say, I don't think that he faked, but I'm sure that they have. My guess is it's less common in a regular kind of way as it is for women to do that. And I'm sure that I've been lied to, or in that, like, a guy is not going to acknowledge that that's a problem.
So let me tell you what some of the data shows. So there's several studies on this. They usually involve college-age kids, because college age is who gets involved with these studies.
Right.
But there are other ones like online surveys where people of all ages can chime in. And in one study from the University of Kansas, college age students, 25% of men said they had faked it at least once.
Huh. That's a high number.
For women, it was about 50%.
Uh-huh. Yeah.
And in other studies, when they looked at men, I think involving a larger age group, wider age group, about a third of men had said that they had done it at some point in their life at least once.
Mm-hmm.
And if you look at comments, that people write in around these things, if it comes up, they say, well, listen, sometimes it's not going to happen.
Right.
You know it's not going to happen. And the reasons that the men give for it, it's so funny, is kind of exactly why the women do it. Nobody's doing this to be mean.
Uh-huh.
On the contrary,
Yeah.
they're trying to be kind,
Yes.
right?
Yeah.
They're trying to say, buddy, or, well, you don't say buddy to a woman, but and nobody's saying this out loud, but you've worked hard, you've done a good job.
Yeah.
Let's just call an end to the evening, right?
Right.
But there's this sense that you can't keep that, especially with the guy, there's the expectation the guy's got to come as the end of the sex act. I think there's less of that expectation with women, depending on the relationship.
Yeah.
But with the guy, it's supposed to be automatic that the guy comes. So we have to keep going until he's done.
It's a lot of pressure on guys. I mean, guys' performance is so evident in general, like if they're hard or not hard or whatever. Women can get away with a lot more without sort of being obvious about what's going on for her.
That's very kind for you to say as a woman.
Wow, it's true.
I think it's true.
Yeah. Yeah. So, like, for example, men will more often have a difficulty either getting erect or having an orgasm with a new partner when they're anxious. That's why.
Of course.
They're anxious.
Right.
But if a woman's anxious with a new partner, even if she's having some difficulty getting aroused in that same way, it's less obvious. And
Right.
she could generally kind of hide it or get away.
Right. And the main issue with women, if we're talking about male-female sexual intercourse, penis inside vagina, the main requirement for a woman to be able to engage in that kind of activity is some degree of lubrication,
Right.
which normally follows from arousal. But the truth is that even if she's not aroused, people can use lubrication. They can use saliva, right? Like it's not an insurmountable problem. If the guy doesn't get hard, that's not happening.
That's right. Right.
Yeah.
So you can understand why it generates so much anxiety.
Yeah. So some guys, this is a surprise to a lot of people, but some guys actually have trouble having an orgasm.
Mm-hmm.
You and I have talked, and it's well known in sort of sex therapy circles, that some men who all men learn how to orgasm before they ever have intercourse with somebody, right? They start masturbating. And there's some ways in which men, young men, boys really, at this age, when they start to masturbate, they don't know what they're doing. They just find something that feels good. And sometimes what feels good for them doesn't translate exactly into intercourse.
Right.
So where they rub against the bed, right?
Mm-hmm.
What's that called?
Oh,
Where they rub
frauderism?
against something, frauderism. Yeah, frauderism. Like that's not exactly the same feeling as happens when a penis is inside vagina.
Right. Well, a woman has that with her clitoris. If she uses her clitoris to have an orgasm, which she very most likely does,
Yeah.
then that's not necessarily getting stimulated.
Right. And if a man uses his hand, like the amount of, some men squeeze really hard, like for whatever reason, and they don't get the same kind of sensation from intercourse.
Yeah. So what'd you tell our friend?
Well, I was actually very proud of that case.
Oh.
Very proud of that case. So, to just go back for 1 second, there are ways a lot of this has to do with training people, right? So like the people who do the frauderism, just the rubbing, you can try and train them so that they get pleasurable sensation and enough to orgasm using things or with the kind of stimulation that more closely mimics penile-vaginal intercourse, right? We're talking about straight men here. And what I did with him is I wanted to know what he thought of when he came, when he was able to make himself come. and what his earliest experiences were with all that. And it turned out that his first orgasm was he'd been in France, and there was some woman around, and had the scent that he thinks of as sort of Parisian or French thing. And of course, scent can be quite powerful. It's the whole industry of, perfume and colognes and all that. And so I told him to go around and to the perfume counters, find something that brought back,
was smart.
that was reminiscent to him of that, and to give it as a gift to his partner and ask that she wear it and tell her that he really liked
that's
it.
Brilliant.
And he did, and she did,
And it worked.
and it worked.
Oh, I love it.
Yeah.
What a happy ending.
Yeah, it was a happy ending. Ooh, that's good. Yeah, very good. You're clever, Dr. Brandon. Anyway, so, we get back to, so why do women fake it?
Same reasons that you just said for men. Women will fake it because they want to please their partner. They're in a place where they can't have an orgasm, or they're done. They want to sort of finish the situation, and that's the way to do it.
Yeah. Yeah.
So,
Yeah. And men do it so here's the amazing thing. Men do it for the same reasons.
yeah.
It's to be kind.
Yeah.
So,
Well, it's not always to be kind. I think that sometimes it's to be selfish, frankly,
so you can go to sleep.
or whatever.
But there's different ways, but it's a kinder way of saying like, this is over.
It's a kinder way.
Right?
That's true.
You could just say, hey, we're done.
Yeah. That's true. That's true.
Buddy, roll off.
Okay.
Right?
So of all the options,
I think it's a kind way. It's like you did a good job, and
Yeah.
let's call this.
Yeah.
Let's call it,
Yeah.
right? But there are reasons why men do this and why they're inclined to. So we talked. One is about men having difficulty with having an orgasm, but there's some men who have no trouble having an orgasm, but on a given night or a given event, it's just not going to happen. They may not even know why.
well, it could be they drank too much. I think that's a common one.
Very
for
common, yeah.
everybody. Or maybe they're on a medication that makes it more difficult.
Perfect, exactly. So men, especially like the SSRIs.
Yeah.
So these are the antidepressants. Big problem with them is a lot of men have trouble having an orgasm.
Right. Women too.
Yeah.
Yeah.
We call it anorgasmia. Or in some cases where it happens, but it takes a long time, we call it delayed ejaculation. DE as often gets abbreviated. And as men get older, it actually becomes more common that they have trouble having an orgasm.
Because of hormonal shifts.
For
right?
hormonal stuff, low testosterone can certainly contribute to it. And sometimes I think, our nerves just don't work as well. We're just not as sensitive.
So that's the case for women too.
Yep.
As women age, it can become more difficult to have an orgasm.
Yeah.
But hormone supplements can be very helpful in this situation.
For sure, if men or women have low levels of testosterone.
Yeah.
So let me get back to the ethics. Well, I don't know about ethics, but let's call it ethics.
Okay.
So this guy was very concerned that if his lover found out he was faking it, she would be done with him.
Right.
So we're not here advocating. I won't speak for you.
Okay.
I'm not here advocating that men should fake orgasms like routinely just when they think it should be over, right? There's a downside to that. Do you want to comment?
Well, I agree with you. I think that when people get used to being inauthentic in sex, it doesn't end well. Like it doesn't go in the right direction because people start to like not really show up, and then they are not feeling vulnerable. And without those sensations, it's much more difficult for them to get excited again. So, here and there faking, I mean, I just don't see it's a big deal, but it's definitely not a habit you want to get into because it's hard to kind of crawl back out of that once it gets started.
Yeah. Authenticity.
Yeah, it's important.
Yeah. Okay.
So, but what I do tell people, now, as I've said, I've worked with women with this concern who had faked a lot over time. I've never had a man say he faked a lot over time. Again, not that person hasn't been in my therapy room, but they've never told me that. But at any rate, what we talk about is the fact that if you keep faking, you're going to start to dread sex because it's going to be this thing that it is a performance. It has not about pleasure, and you're going to start to not to want to participate. So you probably need to solve the problem. And you have two choices. You're either going to be honest, or you're going to have to sort of find a way to start to have challenges having an orgasm till you get to a place where you can rework it and make it work for you. So the honesty thing, if people are willing, is always the best approach, it seems to me. Just say, hey, you know, this started when I was embarrassed and I wasn't able to come, and then it just sort of felt like hard to acknowledge, and then I just kept doing it, and then it became harder to say anything. And, you know, tell your story and be honest about it. And, you know, if you're in a relationship with someone who cares about you, chances are they're going to hear that and have some compassion, I would hope. But if that's not what people are willing to do, then what I say is then start delaying it. Don't have your orgasm just the same way you always do, and start saying it's feeling harder to have an orgasm, or, you know, put it off longer, or just, you know, every once in a while, don't come, and start to build a case for the fact that it's getting harder and harder to have an orgasm.
Yeah.
See if you can't find your way that way. It's a much longer path.
Yeah. You know, in this conversation, I just remembered a patient of mine. This is from so long ago. And I haven't thought about this, it's probably 20 years. But I remember this guy coming in. He'd been married a long time, like 10, 15 years. And like a laborer type guy. And he breaks down and he starts telling me, he'd been a patient before. This wasn't what he came in for. He says, my wife just told me that in all our marriage, she's never once had an orgasm. Now, what I may not remember any of the details accurately, but what I remember about that was, I don't know that she was faking her orgasms, but she was his first and only partner.
Yeah.
And he thought that everything was going fine.
Right. Yeah.
And her sharing that information with him made him feel like he wasn't much of a man. Mm-hmm. And I confess, I don't remember what happened to them as a couple, or, you know, whether that was the part of something. I just remember that the impact of that and him breaking down in my office.
Yeah. Well, you know, she could have done that in a moment of anger and sort of said it ragefully, like, you're not the man you think you are. Like, I've never had an orgasm. Like, it could have happened in that kind of context.
Yeah.
And been, like, cruelly intended.
Yeah.
You know,
he didn't, he took it as fact.
It probably was.
Yeah. And so, and the reason why it's relevant in this conversation is that guys do want to be great lovers. Mm-hmm. They want to be able to think of themselves as great lovers, whether they are or not, right? And one of the things that how a guy evaluates whether he's an okay lover is whether or not his partner is able to have an orgasm. Mm-hmm.
So this gets very tricky, because it is absolutely the case that men say in my office all the time that they want to please their partner and they want to be a good lover. Like, it's a very genuine, caring place. But what can happen is that can get translated to his partner as a lot of pressure. So now I have to do this right so that he feels good. And then she gets angry. So this is a very tricky issue for a lot of couples, what you're talking about right now.
Yeah. And really, I think what it underscores is how tricky sex is, right? Mm-hmm. So we think of it from the movies, well, depending on the movies, old-time movies, which were a little bit more rose-colored, you know, as this beautiful, magical thing. In fact, it can be, as much as there is that's positive about sex, it's also a source of tremendous frustration and challenges within relationships.
And I tell you what, people are more and more sort of acknowledging this point and aware of it. And this is, I think, opening the door for tech, because, you know, technology, your orgasm with tech, there's no shame in that. Like, if people don't function, they don't have an orgasm right away or whatever, they're not ashamed. Tech isn't going to come down on them and say, like, you know, what, are you kidding me? You can't come, or whatever. So I think that as sex tech becomes more and more popular, this is part of the reason people are feeling the pressure of sex that's becoming sort of more a part of our discourse, and people don't want that pressure. So it's just a really easy way to have an orgasm to go to tech. So I do worry about that is paving the way for, I think we're just seeing less and less sex and more engagement with tech, particularly among young people. And I think this is a part of it, what we're talking about today.
I think maybe humanity's last hope, Dr. Brandon, is that they listen to you and our podcast to try and continue with human interactions and intimate relationships rather than tech-based interactions.
Right. As I always say, like, use your tech to enhance your relationship, not take the place of it. But
for those of you who love humanity,
yeah,
you have to stick with us. Right. This is the Sex Doctors Podcast.
That's right. That's right.
All right. Well, listen, I think we did it. And that was fun.
Yeah.
Yeah. So if you like this material, give us a thumbs up. Subscribe.
We'd love that.
We love your comments. And check out our website for other episodes, thesexdoctorspodcast.com.
That's right.
We have some surveys on there. Are they active yet?
Yeah.
We have some surveys, maybe be interested in contributing, stuff that we're going to be talking about in future podcasts.
Or if there's something you want us to be discussing, you can leave us a note on the website. We'd be very happy to know what you're interested in.
Cool. Okay. Well, bye-bye for now.
Cheers.